Good morning. This is Mike Berkeley with the Berkeley Center for Reproductive Wellness. Today's mini presentation is really for acupuncturists, but patients may find this interesting as well. So, dear acupuncturist, patient comes to you and says, I'm very uncomfortable with seeing a medical doctor or reproductive endocrinologist for my infertility case. I don't want to be poked and probed, and I don't want to have to take drugs and medicine, and I really prefer to utilize a natural method of intervention to help me conceive. And so my question is, how many of you will accept that patient? So for those of you who will accept that patient, this is a huge clinical error. So, how do you know if the patient has blocked tubes? How do you know if the patient has a hydrosalpinx? How do you know if the patient has endometriosis, endometritis, adenomyosis? How do you know if the husband doesn't have or has sperm DNA fragmentation? How do you know if the patient has polyps or fibroids? How do you know what the hormone levels are? You don't. And so you are ending up treating a patient without having all the information. You have the information that you've obtained through the 4 examinations of traditional Chinese medicine, but that's really not enough in today's day and age. And if Sun Tzu Miao were alive today, or any great physician of Chinese medicine, they would be looking at blood work and hormones and trying to figure out if patients had polyps or fibroids or any other mitigators to fertility. So my strong recommendation is that you should never see a patient unless that patient has first been examined by a reproductive endocrinologist. Then, and only then, can you actually know what you're treating. Yes, I understand that you can arrive at a differential diagnosis via traditional Chinese medicine intake. However, that intake will not allow you to find out whether or not the patient manifests with the pathologies that I've already spoken to. So the best case scenario, in my opinion, is to first send the patient to a reproductive endocrinologist for an evaluation and then subsequently see the patient if you think that is a patient that you can help. So wishing you good luck and Godspeed in all your cases. If you want to find out more about me or the Berkeley Center, please visit berkeleycenter.com. That's BERKLEY, center.com. And for any patients watching this, or prospective patients, if you'd like a consult with me, I can be reached at 212-685-0985. It's Friday, so I guess I'll say have a great weekend. Thanks so much for watching. All the best. Bye.